trying to go online. What is this? Okay. So good morning, good evening, doctors, nurses, and pharmacists. I'm Dr. Che, and today this is our speaking feedback class. So first we will do one nursing role play. So if any doctor wants to do the role play, then we can do with doctors. But overall, the things are same because your criteria in the speaking, okay, your assessment criteria the same, and even most of the role plays are similar role plays, because the main thing is how to talk with the patient, how to deal with the patient. So these things are the main and important things. Okay, so overall is the same assessment criteria, clinical communication criteria, and linguistic criteria. So we have two types of criteria. Anybody can repeat me with me how many types of criteria we have. Rabil Somro, you should be in my WhatsApp group where I share the Zoom link so that you can do that. Maybe next time, please. So, okay. So what we need to do now? Okay. Just so if you can share this session with other doctors, nurses, and pharmacists, that would be great. So we will be doing this session for speaking feedback. That will be detailed feedback. Yes, Shah Faisal, you can join just after the class. You can send me a message on my WhatsApp, and I will ask some questions, and then you will be added. Okay. My WhatsApp number is given on my page. You can see anyway, everywhere. Okay. Okay. Just we are trying. If you people also can share the session with other doctors, nurses, and pharmacists, that would be great. Okay. Okay. So still we have any doctor who wants to do the role play, you can do, please. Any doctor who wants to do the role play first, because usually doctors want to do first. But anyway, today let us start with nurses. So if any doctor wants to do the role play, then we will do. Okay. So first nurse who will do the role play. So there were two person who wants to do the role play. First one, Nirma. Nirmu or Nirma, what was the name?
Sir, my name is Nirmala.
Okay, Nirmala.
Yes, sir.
But here in the chat is written Nirmu, yeah? Is your
Yes,
nickname?
sir.
Is your nickname Nirmu, yeah? Okay, Nirmala. Okay, for us is Nirmala because we are in the formal class, okay? So this is your role play. Can you see the role play on my screen?
Yes, sir, I can see.
Okay. So this is your role play, and 2.5 minutes to prepare. Okay, in this time, I will be silent and the student will be also silent. because this is the preparation time, and during preparation time, the student can read the role play, can think about, what she is going to talk about. So then we will do the role play, and after that, I will give the feedback. Okay, so if you are on Facebook, don't leave, please. Just we are silent because the student is preparing for the role play. So 2.5 minutes to prepare, please. Okay, Miss Nirmala. You are a nurse, yeah?
Mm, yeah.
Okay, start, please.
Okay, doctor. Okay.
Let me know when you are ready, please. Let me know when you are ready, Miss Nirmala. Can we start? Miss Nirmala, can we start? Please unmute. No? What is this? Can you hear me, Miss Nirmala? Can you hear me? Can anybody else hear me, please?
Yes,
Yes,
yes.
doctor. Yes.
So, Miss Nirmala, can you hear me?
Yeah, we can hear you. Yeah.
Yeah,
Go ahead.
but the student who was preparing the role play, she is not there. Miss Nirmala. Okay, Miss Jivanti, can you hear me? You want to do the role play?
Yes, sir.
Sir, shall I continue?
Uh, who is this?
I am Taranga.
Okay, Miss Taranga. Okay, so this is your role play. Miss Jivanti,
Okay.
I can do with you because you are one of my students. You don't need to worry.
Okay, sir.
So,
Okay.
Miss Taranja, this is your role play. Just you have 1 minute to prepare because you already know. You already seen the role play.
Hello, good morning. My name is Taranga.
No, just let me. Are you ready?
Yeah, okay.
Are you ready to start? Okay, just let me start timer.
Hello, good morning.
1 minute,
I am
please. 1 minute.
okay.
We need to start recording also. Start, please.
Hello, good morning. My name is Taranga. I am the attending nurse today. I can see that you seems worried. What's bothering you?
Uh, Doctor, I'm here because my daughter was admitted here and I cannot see any improvement in her condition.
Okay, I'm really sorry. I'm sorry hear about that because I can understand your situation as a mother of your baby. Uh, but don't worry about that because your baby is now in some improvement. Uh, are you happy with it?
What improvement? She is still having fever. So how you can say there is improvement?
Yeah, but your baby's respiratory rate is now 22 and pulse rate is 94. But and when admitting your baby to the hospital, she is having difficulty breathing. But now it's no uh, any problems with the respiration. But little bit increase your uh, baby's temperature, but it can be reduced continuously. Is it clear?
Okay. Okay, but he is still having temperature and I don't know what should I do.
Yeah, that's good question. Mm, oh, when your baby admit to the hospital, your baby's body temperature was 40 centigrade, but now it's 38. Uh, but it's a little bit uh, increased, but it can be gradually normal. And we, when your baby's temperature, we can reduce your baby's body temperature with using non-pharmacological measures. It means you can use plenty of, you can give your baby to plenty of fluids, and we can apply cold compress in on your baby's head to reduce the temperature. And mm, we can uh, wet your baby's under the axillary side and abdominal side to the reduce body temperature. Am I clear with you?
Yeah, miss, if you people are not going to give any medication for the fever and I need to do give fluids and these compressions and these things, then I can go home. We want discharge. I can do these things at home. So why I am here at the hospital?
Yeah, that's good question. Uh, but your baby's condition is uh, continuously improving now, and yeah, according to your baby's condition, we have to continue antibiotic therapy to reduce the infection, and we have to continue oxygen therapy because in uh, he is in a severe pneumonia condition, and we want to follow up care for him. Therefore, we can't discharge your baby until reduce the his body temperature to normal level. Uh, do you have any other problems with your baby?
Yes, I have many problems. I have not seen any doctor seeing my baby, seeing my daughter. I think doctors are not interested in treating her.
No, no, don't worry about that. I can feel you as a mother because um, you, you and um, uh, actually at that time uh, the doctors are in emergency case, and after complete this after at that time the doctors are in the emergency case, and doctor will come to see your baby. I'll check your baby's vitals, then respiratory rate, pulse and body temperature, and I will inform to the doctor. Mm,
Okay, miss. Okay. Okay, miss.
Okay. Do you have any other problems?
No.
Okay, thank you for cooperating with me, and I wish to your baby's speedy recovery.
Okay, thank you. Please, why people you unmute and then we got problem with, Okay, thank you. So it was good try. This is your first time you're taking the exam?
Yes, sir.
Okay, good. Okay. So overall, you have tried very well. And, it is also important because many students even don't have courage to do this. But if you start like this, then of course you will improve with time. So first of all, you don't know to whom you are talking, okay? Have you asked my name? My daughter's name?
Yeah, I couldn't ask.
Okay. So actually, in your exam, the examiner will not just mark just after, listening that you have done this. And, for me, for example, without going into details of assessment criteria, I will give you C grade, okay? But the examiner cannot give directly C grade like this, okay? Examiner have to give you marks on each criteria and each sub criteria. So one of the sub criteria, I have already explained in my YouTube channel, so you people can see the details. So one of the assessment criteria is building good rapport, okay? Sub criteria, building good rapport. Please, other people should mute, okay? So building a rapport with the patient. So one way is rapport to be polite, to be, very polite, and you should not discourage the patient. You should not be judgmental. And one way is to use the name of the patient, use the name of the baby, okay, throughout your role play. So it would help you to build a good rapport with the patient, okay?
Okay.
So another thing is, so just let me adjust something here. Okay, I need some adjustment here to show my video also. Okay, so then throughout your role play, you can see that there was a lot of hesitation. Yes or not?
Yes, sir. Yes, sir.
So if when you are talking with your friends, you will see if you do the same thing, same role play with your friend, then you will do it very, smoothly. Okay. And if you do this in your mother language, even you will be perfect. Okay. Because here you are thinking what I'm going to say next, what I'm going to say next, what I'm going to say next, which tense I'm going to use. Okay. Which vocabulary I'm going to use, how I'm going to answer this patient. So these things. So when you keep thinking like this is due to lack of practice, okay? Everybody, all of the doctors, nurses, you have good enough knowledge to get B grade in speaking. You don't need to worry because your grammar, your vocabulary, your English, that is enough to get B grade. Just you need to understand and you need to practice, and you need to get, proper feedback and advice from somebody who is, really knows about this thing. Okay. So be okay.
Okay, sir.
Thank you, Dr. Mayu. So you need to be, fluent, and think already. You should decide what I'm going to say and these things. There were a lot of grammatical mistakes, and you need to improve your grammatical mistakes also. And okay, be polite, don't become hesitant. Just think that you are just a normal conversation. So you will improve a lot. Okay. So now I'm going to tell you how you will do the role play. First of all, as the greeting, you need to change the greeting according to the scenario. Is this scenario new patient, or is this patient is already admitted? And this background noise, please. Okay. So, okay. So, Miss, you need to Miss Taranja. Okay. So, what I was saying, yeah, these people with noise, they just break the. Okay,
Sir, we
so
were
this is a
talking.
new patient. Yeah, new patient as revisit patient means the patient is already admitted. Mr. Taranja. Sorry for my pronunciation. Can you hear me,
Sorry, sir.
Mr. Taranja? Is this a new patient, or patient is already admitted, and this just like a revisit or review
Already known face.
discussion? Is known patient. Okay,
Yeah.
so the start would be different here. Okay, even the patient is already admitted with you
Yeah.
in the hospital. Okay.
Yeah.
Okay, so you will start in a different way. So you can ask my name and my daughter's name during preparation time. Could you please tell me how can I call you during the role play? You can call me Jenny. Okay. You can call me Diana. Okay. And your daughter's name? She is Jenny. I am Diana. Okay. Okay. So now you have not started the role play. You have asked this before role play. You can ask at the start of role play also if you wish. Okay. So good morning, Miss Diana. I am Tanuja, one of the nurses taking care of your daughter. Okay, one of the nurses taking care of your daughter. You can see the difference. I am one of the nurses taking care of your daughter.
Yeah.
So, uh, could you please tell me how much you know about your daughter's condition? This is one thing. Could you please tell me how can I help you today? This is one thing. Could you please could you please tell me how your daughter is doing now? Okay. Other thing is, Miss Diana, I'm, 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 you can use, I'm Jenny, one of the nurses taking care of your daughter. And what else you can say? So you can use different ways. Okay. You can think about these things. Okay. Then, okay. So the patient will start, I'm here because, she was admitted and there was no improvement and this and that. Then you need to acknowledge patient's concern. Okay, Ms. Jenny, Ms. Diana, I totally understand your concern, but let me reassure you, use the word reassure, okay? This is written here. Let me reassure you, Ms. Jenny, that as you know, that your daughter was admitted here with severe pneumonia, and her condition is improving now. Just, okay?
Yeah.
Don't explain each and everything in the first go, okay? The patient will ask next thing, okay? So how you can say she is improving? She still have fever. She still has fever. This and that. Yes, Miss Yani. Yes, Miss Diana. You are right that she still has temperature of 38 degrees centigrade. But let me explain you. Okay, now is explain.
Yeah.
But let me explain you that when your daughter was admitted here, her temperature was 40 degrees centigrade, and now it has improved a lot. And apart from that, you don't say respiratory rate 22 pulse this, and apart from that, now her respiratory rate, her respiration and her heart rate is also in the normal limits. And she does not have any shortness of breath. You don't use dyspnea, okay? She does not have has any shortness of breath also, okay?
Yes.
So, okay. So the patient can ask any other question, then you will say this and that. No, I want to go home, I want a discharge. When patients say, and in any role play, when patient says, I want discharge, I want to take my son or daughter home, okay? So you will say, yes, Miss Diana, it is your right. If you wish, you can take your daughter to home, or you can you can get discharged. Okay, but let me to explain you that we are doing our best to treat your your daughter's condition. She has severe pneumonia, that is infection of lungs. Okay, you can explain in simple terms, that is infection of lungs, and we need to complete her antibiotic treatment, and she might need oxygen at any time. Okay, respect patient's opinion. Yes, you can. Yes, you can get your daughter discharged, but I totally agree. I totally, you know, uh, you can just appreciate what patient will say, but then say the opposite thing that is not good for her health. Okay, then you will say non-formal. Yes, you can do this, but explain in two chunks. Okay. And then your last explanation was not good because you were using just memorizing that the doctor is busy in emergency department and this and emergency patient. No, this is not the case here. As the patient is stable, you can see explain the doctor checks stable patients once in 24 hours. If complication, they can see anytime. So you will explain like this. Miss Diana, I totally understand. I, I, I totally agree with you that the doctor have not seen your patient for the last 10 hours, 12 hours, whatever you say, okay? But let me explain you how the things work here. If our patients are stable and they don't have any complication, mostly the doctors see them once in 24 hours. So as I told you that your daughter's condition is stable now, that is why the doctor has not seen your daughter. Please mute, this is not good. Let me mute. No, I'm going to, no, nobody will be able to. Okay. So now I'm going to unmute only. Miss is NIR. Okay. Where- Can you hear me, Miss, who was doing the role play? Miss the it was okay, Taranja, yeah. I'm going to send you a, you will see unmute. Yeah,
Yes, sir.
you can, yeah. Okay, no, nobody will disturb us because you and me only can talk. People start background noise and then it breaks my, flow, and then, many, what I say, many tips, go away from my mind. Okay.
Yeah.
Okay. So this is how you will explain the last point. Okay.
Yeah.
Okay. Now you will do this role play again with me. Okay. So I think you don't need time. You still have 1 minute just to think, okay, what you will ask and what you will do. Just think again, 1 minute to think. And then we will do the role play again. Okay, voice is not clear. Other people, can you hear me well? Just write in the chat. Can you hear me well? Miss, you just keep preparing, okay? Miss Taranja, just keep preparing. Other people, let me know if you can hear me well or not. Okay, good. Use your preparation time to think how you will explain, how will you do. each and everything. Okay, thank you. Are you ready?
Yes, sir.
Okay. So your time starts now. You have,
Hello, good morning. I am the attending nurse today. My name is Taranga. Are your baby Jenny's mother? Am I right?
yes,
Okay. Do you have any other problems with your baby's condition?
other problem means what? I have told you any problem before. You are asking me other problem.
Sure.
So do
Do
the
you have?
greeting again. Again, start again.
Hello, good morning. My name is Taranga. I am your, uh, I am I am the attending nurse on duty today. Are your
So,
baby?
so you are on duty. It is a good, but you can be a little bit more specific. I'm one of the nurses taking care of your daughter.
I am one of the nurses taking care of your babies today. Uh, are your baby Jenny's father?
Yes, I'm her mother, and my name is Diana.
Okay, thank you, Miss Diana. Do you have any problems with your baby's condition?
So problem is not good, okay? Problem is not good, okay? You can ask concern. Ask, do you have do you have any questions about your daughter's condition? Any concern, or what you know? Do you want me to explain anything about your daughter's condition? Maybe something like that, okay?
Do you have any
Concern about your daughter's condition. Just use
Do
concern.
you have any concerns about your baby's condition?
Yes, nurse. That is why I'm here to talk with you. My daughter was admitted here 2 days ago, and
Yeah,
I cannot see any improvement in her condition, and I'm really concerned about her condition.
yeah, I can understand your feeling as a mother, but don't worry about that. I can reassure you because you were on admission. Your baby's body temperature was centigrade 40, and now it
Just
is.
first tell that improvement and then explain the specific why it is improved, okay?
Uh,
Okay, let me reassure you and then
Let me reassure you. Don't worry about that because your baby's improvement. Uh,
your daughter's condition has improved.
your daughter's condition your daughter's condition has improved, and then your baby on admission your baby's body temperature was
Just stop here
centigrade.
because I will ask the question about the temperature, okay? Okay, so you just tell that the baby's condition has improved and uh, just like this, okay, explain. But the nurse, you told me that her condition has improved, but she still has temperature. I don't know, she still has fever. I don't know how you can say her condition has improved.
Yeah, as a mother, that's good question. But you, on admission, your baby's body temperature was centigrade 40, but now it is centigrade 38. It's little bit reduced, and your baby's other conditions, then respiratory rate, pulse rate, are reduced than admission time, and your baby's respiration abilities improved. Am I
Okay,
clear to you?
why you are struggling with this thing? This is simple. Just use first the 40 and then degree centigrade. Okay. Uh, Miss Diana, I totally understand your concern that it is true that she still has temperature of 38 degrees centigrade, but let me explain you that when she was admitted here, her temperature was 40 degrees centigrade, and now it has improved a lot. And apart from that, her other vitals like her respiration, her heart rate has also improved in the normal range, and She does not have any difficulty of breathing, any shortness of breath. Okay, I'm using these things written here.
Yeah.
You make it easy. Why you are making it difficult? Okay. Then again.
Uh, so it
Okay, miss,
start
you
to,
told me that her condition has improved, but my daughter still has fever. How you can say that her condition has improved?
yeah, as a mother, I can understand your feeling, but don't worry about that because on admission, your baby's body temperature was centigrade 40. Now it
40
is
centigrade, not centigrade 40. 40 centigrade.
40
40
centigrade.
degrees centigrade. Yeah.
Now, uh, now it is 38 centigrade. It's little bit reduced.
Little bit,
Let
no, it has improved. It has
it
reduced, not
it
little bit.
has reduced. Uh, Let me explain. Apart from that, your baby's vitals are normal. It means respiratory rate 22
No, not
on
till 22 because the patient does not know what is 22 is normal or not. Okay, her respiratory rate and pulse are normal, and she does not have any shortness of breath also. Okay.
yeah, respiratory rate and pulse rate normal, and then your baby's uh, breathing ability is normal. Am I clear to you?
Yeah, okay. So this is how you need to improve, okay? Gradually, slowly, just, you need to practice, but under supervision and, do these things, you will improve, okay? So any doctor who wants to do role play, then we will do for nursing again. Any doctor who wants to do the role play? Oh, I have to unmute you because all of you are, now you can unmute. Any doctor who wants to do the role play? Any doctor who wants to do the role play? No? I think most of you are nurses. No, there are some doctors also.
Hello?
Yes, please.
Yes, I want to do.
You are a doctor?
Yes, I'm doctor.
Okay, just give me 1
Uh,
minute.
just 1 second. I will just take pen.
Okay, no problem. I will show you
Okay.
the.
Just
Then if we have time, we will do one more nursing role play. The thing is, I need to explain in, detail the things. Not, okay. So, your good name, doctor?
I'm Dr. Mustarhe Mainam.
Okay, thank you, doctor. So, this is your role play, 2.5 minutes to prepare, please.
Okay, fine.
Okay, let me know, Dr. Wells, you are ready.
Okay, just how much time I will get? I did
For
not note.
5 minutes to do the role play,
Fine. No, no,
and
just for
to preparation 2.5 minutes. Just I'm saying when you are ready, okay?
fine, fine. Okay, doctor, this card will be remain in front of me, or you
Yes,
will
in the real,
remove?
no, in the real you will get in front of you also. Even you can underline,
Okay,
you can write also on the role play if you are taking me in
okay,
front face to face exam. So it will be in front of you, don't worry. Okay, I think we should start because,
yes, yes, okay.
okay, start please.
Hello, good afternoon. I'm Dr. Mustarhema, and I'm here to for your baby examination and checkup. Yes, tell
Okay.
me what happened to your son.
Uh, Doctor, my son is not feeling well for the last 3 days.
Oh, I see. What happened to him?
Actually,
Can you
he
tell
is,
me him?
yes, he is having fever, doctor.
Oh, I see. How many days he's having fever?
For the last 3 days, doctor.
Oh, oh, fine. And anything else except fever? Like, is he having any difficulty in the breathing or feeding?
Uh, Actually, he is not feeding well, you know, and he is crying all the time.
Okay. Do you feel that he has any other associated features? For example, there is any sounds coming from his breathing,
Uh, I don't know. Sometimes, yes, I listen like whistling sounds.
or some other, or some other. Yes. Okay. 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 And any other associated symptoms or any other associated things with his symptoms?
No, doctor.
Okay, I have examined your son, and let me explain you that. Yes. Okay, okay. Let me explain because as according to my examination, your son is suffering from a condition. This is called bronchiolitis. In this condition, actually, there is infection of the respiratory tract of the airways, air passages in the lungs, and mostly this infection affects the children, babies and younger children who are less than 2 years old. It is common in such babies, and usually most commonly it is caused by viruses. Okay, so hopefully with the medications and with the general measures, your baby's condition will improve. So I think you no need to don't bother and don't worry to
Oh, okay, doctor.
yeah. Okay,
But
are
you
you
know,
with
doctor,
me? Yeah.
yeah, I am with you, doctor. And you
Okay.
know, doctor, I have only one son, and I don't want any problem for him. Just
Yes, exactly.
could you please admit him in the hospital so that he gets a good care here in your hospital?
Yes, I can feel your feelings as a mother, and you have only one son. I can feel that you are very anxious and about his condition. But I want to assure you that your baby is not in severe condition, and nowadays this is common virus infection, and most of the babies are affecting with this virus. And as the baby is not in such a serious condition, he don't need admission at this time. Usually this condition will resolve in a few days, like 3 to 5 days. And this at home you can provide him better care. Home care will be better for him. And you can give him plenty of fluids, you give him exclusive breastfeeding. And if he has fever, you can give her paracetamol as needed. And it's better in the environment if you avoid any smoking, because smoking, passive smoking will aggravate the increase the symptoms of bronchiolitis. So it is better if you will keep your baby at home with your home care along with paracetamol fluids. He will improve better. And at this stage of the disease, he don't want need any admission. And I
Okay.
reassure you that this condition is not serious. And if I will tell you some symptoms. If these arise, you can return immediately to hospital. Hospitals are usually 24 hours open emergencies. In case the baby will develop any serious symptoms, for example, you feel that change in the discoloration of the lips, like the lips become cyanosed or bluish in color, or the hands or legs become bluish color, or you feel change in the color of the limbs, skin, or your baby if develop increase problem in breathing, any difficulty in breathing, shortness of breath, or you feel that baby is having sometimes in between breathing he take pauses in respiration. This is called apnea. If you feel your baby is suffering from this condition, you can immediately return to hospital, and doctors will be there, and we can manage the condition if he becomes serious. But at this stage he's fine.
Okay.
Are you with me? Did you understand my explanation?
Oh, no, no, I was sleeping. Thank you, doctor.
Okay, thank
I
you.
didn't understand what you have said, but thank you, doctor. Okay. So good. Your English
Okay.
is very good. Excellent. Excellent. Okay. So people who are with us on Facebook and those who are with us on Zoom, just give us idea what should be the score for this role play. Anybody wants to give his or her input? What should be the score for this role play, please? Okay. So let us see. So Dr. Amna says B because she is a doctor. So doctor will respect doctor. Okay, B. Other person gives C plus. C. Sajad Khan gives C. And one Jabril Khan is very, kind for you. He is giving B plus. And somebody C plus. Miss Rabia gives you C. Okay, and okay. So doctor is like C, C plus grade. C plus, okay. So just I have some questions. Is this your first role play when you started your preparation of OET, or you already done, doctor?
I am in between still.
Okay, when is your exam?
It is in February, 11 February.
Okay, okay. So you're taking for the first time.
Yes.
Okay, good. Doctor, your English is not a problem. Okay, your English is good,
Okay.
but still you will get C or C plus for this. C,
Okay.
most
Yeah, I
probably
want to
C.
know, yes,
Yeah,
deficiencies.
actually, my question is the main question. How many times you have you have done the role play in 6 minutes. In 6 minutes, how much time the patient have spoken and how much time you have spoken? Okay, can you give me an idea? Just people, those who are listening, any idea how much time she has taken and how much time she has given to the patient, to the mother, to participate in the role play?
The parent, she gave half minute to the parent only.
Yeah,
was
half,
what I
even less than 1 minute, okay?
Yeah.
Less than 1 minute. And
Not even
you are
after the
speaking for
question.
5 minutes, more than 5 minutes for
Yeah.
you. And for me, only
Yeah.
30 seconds are just, 1 minute. So, doctor, this
Yes.
is two-way communication, okay? You need to talk with
Okay.
patient. You need to take, even when you plan any management plan, so you need to take the patient in
Okay.
the decisions. This is not in like in our home countries where you just impose what is the treatment, okay? To the just this is this, take this and go home. No, here in UK, no. In here, you need to explain one by one everything the patient should understand, and mutually both of you should agree on the plan that you are going to give to the patient.
Fine. But actually, I had to give so much information to the patient that I
That is,
thought it
you
will
will
be.
give, don't worry, you will give, okay? You will do this role play again and you will give in 5 minutes. You don't need to worry about this, okay? So
Okay.
you have spent 2 minutes on your first bullet point only. Say only first bullet point in 2 minutes. And
Fine.
you can do this in 30 seconds, 40 seconds. Good morning.
Yes.
Good morning. I am Dr. Diana, one of the doctors here in this clinic. May I confirm your name and your child's name, please? Yes, I am Diana, and my son's name is David. Okay, Diana,
Fine.
how can I help you today? Doctor, I am here because my son is not feeling well. So I am not giving you the details. I'm just giving you clue, okay? So that you can ask. Then you don't need to go into details, how long he is not feeling well. You just need to ask an open question. Okay, could you please tell me what you mean by he is not feeling well? Okay,
Okay.
so okay, okay. So it's could you please tell me? I'm really sorry, Diana, about your son's condition. Could you please tell me a bit more about his condition? Okay, yes, he is having fever and this and this. If I only tell you at the start he has fever, then you can ask, could you please tell me a bit more? Then I will give you the other symptoms.
Okay.
Okay. So it will take
Yes.
just 40 seconds, 45 seconds, 50 second maximum. Okay. So this is not like, real patient. You don't need to go into details of everything. Okay. In here in
Yes.
OET, you just need to ask what is written on your role play. Okay. So if I give you fever, ask, okay. So then you ask, do you, does he have any, does he has any shortness of breath? What about his feeding? Have you heard any sounds in his chest? Just like these quick questions. Maybe patient will give you some when you will ask open question, then you will. Then after that, okay, Diana, according to what you have told me, I suspect that your son has a condition that we call as bronchiolitis. Not start explanation in each everything. Do you have any idea
Okay.
what is bronchiolitis? No, so you are involving the patient. No, doctor, I don't have any idea. So no, doctor. So actually, just it's a very easy explanation. Actually, this is a condition of our lungs. Okay, this is like an infection of our lungs, and it mostly affects small babies and younger children that under 2 years age, and mostly it is caused by virus. Just okay, no more, enough. Okay, if you give long explanation, the patient will not easily understand. Okay, doctor. So, as you know, I have only one son, and I really am really worried about his condition. Could you please admit him so that he gets a better, treatment here? I totally, I can see, Miss Diana, that you are a very caring mother, and David is your only son. But let me reassure you that this condition is not a serious condition. It is a viral kind of infection. It usually resolves in 2 to 3 to 5 days, and there is no need of admission. Concise to the point, okay? Okay, doctor. So then what should I do for him with this? If I say give him antibiotics, so you need to respond, there's no need of antibiotic. So then you need actually, okay, Diana, Miss Diana, let me tell you that when you go home, please keep, breastfeeding him frequently so that he is not dehydrated. Give him plenty of fluids, and if he develops fever, you can give him paracetamol. Do you understand, Miss Diana? Yes, doctor. So the last point I will say again, okay? One more thing, Miss Diana, I would advise you to stop smoking and close to your baby, because passive smoking is also one of the risk factors. Oh, okay, okay. One last thing, Miss Diana, if at any time your baby, your son develops, uh, his hands are, face becomes blue, or he develops shortness of breath, or there are long pauses in his respiration, please come back to us immediately. Okay?
Okay, yes, I understand.
Now you will do the role play, and I will tell you how the B grade role play looks like. Okay, start please.
Okay. Again?
Yes, the same. Yeah.
Okay. Okay, fine. Hello, good morning. I'm Dr. Mustarhima Hinam, and I'm here for your baby. Tell me what happened to your son.
Okay, ask my name, my son's name. This is not good
Yeah,
way.
what? Okay. Okay. Can I confirm your name and your son's name,
Yes, I'm
please?
Diana, and my son is David.
Oh, welcome. Yeah, can you tell me how can I help you today, and what happened to
Doctor,
your son?
no, one question only. How can I help
Okay.
is enough?
Okay.
Actually, doctor, I'm here because my son is not feeling well. He has fever.
Oh, I'm really sorry to hear about your son. What else?
Could you please
Except
tell me a
fever.
bit more?
Yeah.
Open question.
Okay.
Could you
Would
could
you
you
tell me
please?
a bit more about your son's condition?
Yes, doctor, he is having this fever for the last 2 days, and doctor, he is not feeding well, and he is crying all the time, and I'm really worried and concerned about his health.
Oh, I see. Is your son having any
I
difficult?
see is not the sympathy. Show me
Okay.
sympathy.
Oh, I'm sorry to hear. Uh, uh, can you tell me a bit more? Any symptoms? Do he has any symptom like shortness of breath, or how is his feeding?
Feeding, I
Are
already
they?
told you, doctor. Feeding, I already
Mhm.
told you. You don't need to ask
Okay.
again. So this is
Okay.
active
How he's
listening.
fine?
So
How
he
is
does not
he?
have any shortness of breath.
And any? Do you hear any abnormal sounds while he's breathing?
Yeah, sometimes sounds like whistling, yes.
Okay. Actually, during my examination, I examined your baby, and I think he's suffering from a condition that is called bronchiolitis. Do you understand about this condition? You
No,
know?
doctor, what is this?
Actually, this is a condition in which there is infection of the respiratory tract, and it mostly affects young babies and young children, less than 2 years of age, and mostly it is caused by viruses. Okay.
Okay,
Yeah.
okay, doctor, but
Yes.
as you know, I have only one son, and I'm really concerned about his health. Could you please admit him in the hospital so that you people can take care of him?
Okay, I can understand your feelings as a mother, and you are a caring mother, and you are concerned about your son. And really, we are also concerned about your baby. But actually, during examination, according to my examination, his condition is not very severe. He's not severely ill, and hopefully, this condition will resolve in 3 to 5 days with home care and medications. And at this point of stage, he don't need admission.
Oh,
Uh,
okay, doctor.
do you have any concerns? Anything to
No, doctor. So
ask
what
about?
should I do? No, what should I
Yeah,
do
you
for him,
will,
doctor?
you can provide him home care in which you will give him exclusively breastfeeding and at short intervals so that he will not become
Slow, please. Why,
dehydrated.
why you are hurried? Why you are in hurry? Slow. You're talking to a patient. You're not giving any OSCE exam to a professor, okay? You're just
Okay.
talking to a poor mother, okay?
Okay, fine.
Yeah.
Okay, so I will advise you to give your baby exclusive breastfeeding and give him plenty of fluids. And
Okay.
if he develops fever, you can give her paracetamol.
Okay. Okay, doctor.
And be sure that in addition, okay. And additionally, one thing I will advise you to take care of not to avoid smoking around him.
Okay. Now make a good sentence of this last point. Just think.
Okay.
Make a good
Addition,
sentence.
yeah, fine. Okay. Furthermore, I want to advise you to avoid smoking in his surroundings.
Ah, yes. Okay. Yeah. Okay. Okay, doctor.
Okay. Okay. Fine. So and if you feel any concern, are you feeling any concerns? You have any questions about?
First, you need to explain me the last point because I will not ask this. You will explain me.
Okay, okay, fine. Okay, and you can continue his home care. And if you feel that your baby condition is not improving, or you feel there is some change in the skin color of lips, hands, or legs, or he has any difficulty in breathing, or you feel there is some pauses in his respiration, you should immediately bring him back to the hospital.
Okay. Thank you, doctor. No, you need.
You
Do you
are
have any
welcome.
other concern?
Do
Well,
you have any other concerns, any
no,
questions?
doctor. Thank you. So you have done the role play in 5 minutes and 40 seconds, and with a lot of repetition and with my explanation, each and everything. 5 minutes
Yes,
and 40
okay.
seconds. So you can see that the time is enough.
Okay.
Yeah, the time is enough. And your English is not bad. You just need to use and you need to understand what are the assessment criteria for speaking.
Okay. Okay.
So
Okay, thank you.
you
Yes,
can easily get, no, you can easily get B grade. Just you need improvement. Your English is good. Just you need to fulfill criteria. Okay. So there is one video on
fine.
my YouTube channel about speaking criteria. So all of you should watch that. And
Fine.
other thing is nowadays we have speaking feedback classes also.
Actually,
Means I give
doctor, I have
individual
one
feedback.
question.
Yeah, just
Like,
1 minute. Just 1 minute for me. Then
okay,
you can ask question. So we have speaking feedback classes. We will do the. I mostly provide the feedback like this. Okay, individual first means just my student and with me.
yes.
Okay, direct. We do the role play and then I give feedback. Then I record the feedback and I send. Okay, I explain things. So apart from that, we have writing classes, very good classes, and is a VIP hybrid course. Nowadays, we have 50% discount. Recently, one doctor failed writing 2 times, and she was taking the exam third time, and she contacted me just 6, 7 days before exam. Even she was doing house job, and she was not having enough time to write letters also. But after joining VIP hybrid course, she passed her writing, and so she passed the OET exam complete. So if anybody wants to join VIP hybrid course for writing, nowadays we have 50% discount and we have speaking feedback available also. So your question, please, doctor.
Yes, actually, I want to ask, like, here there are points. So I don't know whether I should jump to the next point myself, or like in the last point, you told me that I have to tell you. And I was expecting
This
that.
is understood. These are the red flags. And being a doctor, you should understand that at the end of role play, sometimes the red flags are given. You need to advise the patient about this.
Because I was expecting maybe you will ask some question.
So at any
That's why I
time,
was
if you
not
think that patient is not asking next question, you can start the explanation.
fine.
Okay, so that is not a problem.
Okay.
So
Okay.
thank you
Thank
so
you.
much, all of you. So have a good day. So our next free
Thank you
class
so
would
much.
be, I think, about writing. Yeah. So I will, that would be after 2 days, and I will send my own case notes. You people can write the letter. You can get feedback, and you will see the explanation of the letter. So it would brand you case notes written by myself. Okay. So thank you so much.